This is Roger Green, host of the Surfing the Mesh Tsunami podcast. This week, we're offering 4 conversations from episode 19, our interviews with Mike Patel, Louise Campbell, and Sven Franke about their impressions of the EASL Congress meeting. Plus, instead of a vault, a special excerpt we cut from Louise's interview so that we could get the overall episode down to an hour and 10 minutes. It's got its own content, its own topic, and it's pretty powerful in its own right. In place of the vault, we have a segment from my June 8th conversation with Louise Campbell that we reserved for this purpose. The specific focus of this conversation is on how practice patterns and guidelines are likely to change over the next several years. One driving factor involves the need to get primary care not only involved, but actively committed to playing a leading role in treatment, given how quickly the identified patient population might grow. Louise points out that the overall rate of growth might be one longer-term issue, but in the short term, dramatic increases in the number of patients with cirrhosis will be a more immediate concern. She questions how staffing and training will need to change to handle both challenges: more diagnosed earlier-stage MASL patients, coupled with more late-stage fibrosis and cirrhosis. She speaks specifically about a poster looking at liver disease as a factor for cardiac arrhythmias and the seemingly confounding idea that PNPLA3, while a genetic target that predicts MASL, might also be cardioprotective within the MASL population. However, it has no effect on MASL progression or other related diseases. This leads Louise to one more optimistic conclusion, this time that we will see broader collaboration between specialties over time as we appreciate the scope and complexity that comes from viewing MASL as part of the broader metabolic disease continuum. As you've heard already, and will hear repeatedly over the next month, this was an extraordinary meeting. These conversations should give you a flavor of the broader discussions we will offer in the next several episodes, starting with drug development on June 20th.
Louise Campbell.
We look at the way we can utilize technologies for liver at the coalface with patients and develop pathways to support our physician colleagues in delivering the best care to patients. And that's going to become more essential, I think, over the coming years. Irrespective of these guidelines, we have a tsunami of cirrhosis coming. We have a tsunami of decompensation coming. A lot of the evidence in some of the abstracts was that the fastest progressing group are from compensated to decompensated. So whilst we're trying to stop them getting there, we already have some on the F3 coming to F4. We've already got the F4s that we haven't found that are going to decompensate over the next few years. So all of this is coming. Despite the excitement of this meeting, we are going to have to, in our hospital clinics, utilize our nursing staff and allied health professionals to better support a dwindling number of hepatologists in some areas. Or do we go comorbidity in that area and just leave specialist hepatology to manage that end? So that's a whole different debate, which I was thinking about in this conference.
Roger Green.
It's a great question, right? And I mean, the metaphor I've been using all along is if you got water coming out of the hose, an increasing amount of water coming out, if you put your foot on the hose and you're completely successful, you still got to deal with all the water that's in the hose after where you put your foot down. And if you view the hose in question as a fire hose, it's unlikely that you're going to be able to stop it entirely. So the CPG guidelines, for example, had very little to do that was specific about what do you do with the water that's past where you put your foot down. They were more about how hard do you put your foot down. To that end, we're looking forward, hopefully, to getting encouraging reviews of drugs that address cirrhosis.
Definitely.
Because that's going to be the other challenge. And if you think back to Stephen's 2 studies, the 2 prospective San Antonio studies in 2011 and 2021, they both had identical MASL rates with NAFLD, but let's just change it because they're the same MASL rates within the population. They had the same MASH rates within the population. They even had the same advanced fibrosis was a little bit higher in 21. No, it was higher, and cirrhosis was higher. So what you're looking at is even if the water coming down the hose stays the same, the fact that it's been growing over time and the people are untreated means there are going to be more untreated people at the back end.
Absolutely. And that's what we're going to be dealing with over the next few years. So I think we have to look at targeting both ends from that. But do we have the staffing resources? We need to look at different ways. And a lot of the technologies and a lot of the care pathways and to care discussions in these groups was we can maximize some beautiful theories. We can maximize some of the nursing data that was presented, the nutrition. We can do that because we've got to keep patients better at the compensated end now to stop them decompensating. And I hark back to hepatitis C days. The first people we treated when we got access to the all orals were the decompensated and compensated cirrhotics because it took them off the timeline for transplant in most cases. And whether or not that is, as we get those medications, where we target. And I always think Manal in my head when we talk about lack of progression. There was a lot more discussion about lack of progression and even some examples of regression. These are exciting times because lack of progression has always been something that the patient groups talk about, and particularly Wayne recently was particularly keen on that aspect. We're getting close to slowing down the ones we know and the ones that we find with advanced fibrosis, but we do have to get out there and start looking a look and open that up.
Couldn't agree more. In that regard, Naeem's paper yesterday about bariatric surgery was just dazzling.
Yes, I was there for that one. That was the one, yeah.
I know you were, because it was part of the CPG session. Just eye-popping, really. Any other impressions to share?
I am going to share one of the posters of the abstract session that I went to because, as I said, there were some big guns there, and I'm just bringing up the poster. But after John did his presentation, which was on resmetirom, there was a lady that came up who I'd never heard of, and her name, and I think this is, there's two reasons I'm bringing this up, because I think this is where we're going to be progressing for nursing, which is really exciting. Her name was Teresa Hides, and she's from Liverpool in the United Kingdom. And she presented a poster called Liver Fibrosis Assessed with Non-Invasive Tests is Associated with the Incident Heart Failure in the General Population Cohort UKBB. So it was a University of Liverpool, University of Southampton combination, and she presented this. And she is a cardiovascular and metabolic medicine nurse. She is not a hepatology nurse. So this was not done from hepatology, which is great to see at a hepatology conference. But basically, she was talking about liver disease factor for cardiovascular disease, MARSLs, ischemic heart disease, arrhythmias. The fibrosis was obviously assessed with adverse liver outcomes and extrahepatic events, but also that PMPLA3, RS378, 409, GG, and TM6SF2, I never get these right, RS5, 8542926TT polymorphisms, whilst they're associated more with, we look at them more in liver disease, they're protective to the heart for cardiovascular failure. So they were looking at that protective nature. But she came on and absolutely nailed this presentation, having had all of the big guns around. Jerome Brussier is presenting it, and Jean had just finished his, and everyone was looking. So my hat's off to her, because the conclusions ultimately of all of this research was that the serum markers probability of advanced fibrosis are associated with the increased risks of hospitalization and death from the heart failure general populations, but the polymorphisms associated with liver fibrosis and protective against cardiovascular disease did not reduce the risk of suggesting that the pathological mechanisms other than ischemic heart disease are driving the associations between liver fibrosis and heart failure. And the data, and I would suggest people go and have a look at this poster, provide compelling rationale for multimorbidity assessment and aggressive cardiovascular risk factor management to prevent heart failure in people with hepatic steatosis. And then obviously we went on to the CPG, which was also starting to do that. But I was really, really impressed. And I was impressed that we have cardiovascular and metabolic medicine now presenting hepatology results. They didn't use any of the screening. It was all blood-based biomarkers. And I don't have enough time to go into all of that here, but it was a very impressive poster, given the rest of the ones that were up there. And it was one of the top posters. So hats off to Liverpool and Teresa Hayes.
Fantastic. Hats off.
And new breed of nurses.
Yeah, and anything in Liverpool is good with you.
Yes, of course, right? It is. But what I want to see, and I think I've discussed before, is I see hepatology being dispersed within cardiovascular specialities, metabolic units, and sharing our knowledge and gaining from them, and that cross-seeding and pollination now. And I do think the CPG potentially offers that as well. So that was my excitement from yesterday.
And with that, let's say goodbye to our audience for now. So welcome back to England.
It's nice to be back. But Milan was lovely. It was autumn temperatures in Perth. 28 in the day and 18 at night, which is what I left at Perth in the late autumn, early winter.
Oh, that's gorgeous. That's gorgeous. That's gorgeous. So it almost felt like you hadn't left.
Exactly.
Excellent.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingmash.com. Until then, stay safe, surf on. We'll see you on the podcast. Bye-bye now.